medical school in Liberia, you are required to have at least a BSc in biology or in chemistry or in pharmacy. I mean, you must have a university degree. Secondly, you must have an accepted grade point average. You should be at least below the age 35. That is optional, so we can consider something about early. And the reason is that when you enter, the minimum time that you will spend in the medical school is over 6 years. And after that, you have a residency program to do and all those things. So we're looking at the life span in Liberia. So we need to take younger people that when they graduate, they will serve long time for the Liberian people. Now, after that, you need to pass an exam, entrance exam. And when you pass that entrance exam, you need to go through an interview before you are admitted at the medical school. And after that, you graduate, you are an intern. During the internship, you are required to rotate in the 4 major disciplines, 3 months in each: obstetric and gynecology, pediatric, internal medicine, surgery. And in each of those departments, you will be monitored by your supervisors. And at the end of your internship, you again sit for an exam for your licensure.
Okay.
Before you practice. Now, for our colleagues or our students coming from China, let me make it clear to the Liberian people, we are not against anyone. Liberia need manpower, but not all kinds of manpower. We need the quality. Now, these students.
What do you mean we need a quality? Does China can provide quality?
I'm coming to that. Most of the students that went to this program went strictly into the program after high school. No BSc.
Okay, most of them.
Most of them. And we were not involved in the scholarship process.
The selection.
The selections.
Okay.
We don't have problem with that. When one of these students returned some time ago, you know, you can be qualified, but the performance is important. When you are performing, no one will question your ability to work. And these first students were placed, and because of the performance, there was an alarm.
The first Chinese train?
The first Chinese train.
Okay.
And this is how, under the leadership of Professor Boto in 5, this question was taken to the Ministry of Education, to the Ministry of Health, and also to the embassy. And it was found out that students sent to China, if you spend 5 or 6 years, actually you do not have a medical degree. That is the degree of a medical doctor. You have a BSc in medical science. Let us say is an equivalent of our students coming from the science colleges.
Okay.
That don't make you a doctor. But for these first students, what did we do? We had a meeting with the education ministry, and she was given the opportunity to go back to China. She spent additional 3 years, and she's back with another degree, and she's being placed. She's working.
Okay. What's her name?
I think Gopudolo.
Okay.
Gopudolo, no way. Now, we have others that have come. You know, the problem is they are not in one medical school in China. They didn't come at once. So others have come. The same question came about. And we have gone to meeting over meeting. Even the medical council have met on this issue 2, 3, 4 times. The Minister of Health, Honorable Gwenigale, called meeting involving all relevant authorities, including the CSA, which is responsible for scholarship, including the Ministry of Education, during the dean of the medical school, and we discussed this lengthily. The curriculum of the medical school in China was reviewed in this meeting. It was found out again that it does not meet the standard.
The Liberian standard.
Yeah. Not only Liberian, but even the international, because we look at courses taught to the students to obtain the medical degree. It is not. Doing biochemistry don't make you to be a doctor. You got clinical material that you have to go
So were they coming as doctors?
According to their document,
Okay.
the Chinese, they put their either doctorate in medicine, so, okay. So, but we didn't start there, my brother. Where to go? China is represented in our country by their embassy.
Yes.
We went to the embassy. You can confirm this from the CSA director, Honorable George Warner. He was part of the delegation. The health minister, in fact, headed this delegation. And we met with the Chinese ambassador, who made it clear to us that, look, gentlemen, these people after 5 or 6 years are not yet doctors.
Okay.
They are giving a documentation proving that they have BSc in medical sciences. They are not doctors. So as far as we're concerned, as LMDC,
So that's the first degree.
that's the first degree, yes. And to become a real doctor, they needed additional 3 years. So as we sit here, in fact, as LMDC, by right, we're not even supposed to deal with them. We deal with doctors when you have obtained your medical degree. So the question was, what next for these people? Because as we speak, we have about 25 of them in China. So we were looking at,
They've come and gone by.
no,
They stayed
They
there.
have told
they are still there, beside the one that are in country now. 25, I have the list in my office. So we were looking at, first, the short-term solution and the long-term solution. What do we do with the people in country? What do we do with the people that stay in school there? And what do we do for the people in the future that will be going there? The ones in country, 2 suggestions came about. One, can government renegotiate with the Chinese embassy for these students to go by and complete?
Okay.
Or can these students go by to our medical school here and complete? The last one, that is, for them to go back to our medical school, the dean of the medical school brought this clarification that, because we were suggesting if they could even go by there and do 2 years to complete, and this was against our policy. We are using a new curriculum that start the clinical training. I'm teaching at the school.
Okay.
The new curriculum state that now we teach clinical from 3rd year, meaning that you cannot spend just 2 years at the medical school now and graduate. So this is where we are, and from there a delegation was formed to be headed by the president of the university, Honorable Emma Dennis, to meet the president, so that this is a high level now, not only LMDC level, so that they can see this is involving 2 countries. How best we can solve this problem. So I call these students and give them this information. Look, the problem now is in the president's office. We have to give her time. This was around Christmas. After Christmas, the president needs to give her national address. After that, then I will call you go back. I was surprised already to hear some of them on the radio or this or that. So the next day they were in my office, and I said to them, look, that does not solve the problem. You are in critical situation. You need to join us and solve this the best way, and not to mislead the Liberian people. You do not have medical degree. You don't have. We are now going to, as I said, as much as we need manpower in this country, we are now going to accept the non-qualified person.
So in China, do they do practical? Like, don't they?
They do, but when you have gone into the second step.
Okay.
But the first step, I can challenge you, please call some of these students. They themselves will tell you that the 5 or 6 years they spent there, they were not allowed to test patients. They were not allowed. And that's why I raised the concern, because when they came, we put them to practice. Many of them, I'm sorry to say it. And that's why that happened. So it's very clear. We are not in fact, I had planned a meeting even with them, with their relatives, because the relatives need to understand. We all have children. I understand your children have gone out of this country. They come back after 6 years. They tell you that they are doctors. We feel for you.
So how many are they facing this particular situation now?
They are coming with it. As I said, they are not in one university.
Okay.
Right now we have about...
No, I mean, personally in the country.
About 5.
Right now they have 5.
Excluding the previous situation with Dr. Poto.
Yeah.
Yes.
Okay.
Yeah.
That is outside of it.
The one with Dr. Poto, as I told you,
Okay.
she went by
And got additional training.
additional 3 years training, and she came by with another degree.
Okay, wonderful. Thank you very much.